Hello, everyone. I am Dr. Abdi Khani. Welcome to today's class. Our topic is arterial blood gases, or ABG. ABG is an important tool in clinical practice, often used to understand the patient's respiratory and metabolic status. Let's start by looking at the basic concepts and applications of ABG. Today's class will be fun and practical. We'll start with what ABG is, then talk about its applications in clinical practice. Next, we'll learn about the assessment of gas exchange, and after that, I'll introduce a fun tool, the Tic-Tac-Toe Method for ABG analysis. And in the end, we'll wrap up with a quiz to check how much you've learned. So what is ABG? It's actually a blood test taken from an artery. It tells us three main things. First, how much oxygen is in the blood. Second, how well carbon dioxide is removed. And third, the acid-base balance of blood. The most common site for sampling is the radial artery, but sometimes we use a femoral or brachial artery. So what is ABG? It's actually a blood test taken from an artery. It tells us three main things. First, how much oxygen is in the blood. Second, how well carbon dioxide is removed. And third, the acid-base balance of the blood. The most common site for sampling is the radial artery, but sometimes we use the femoral or brachial artery. PaCO₂ is the gold standard for oxygenation status. SpO2 is quick and non-invasive, but can be wrong in low perfusion, severe anemia, nail polish. COA, a gradient tells us if low oxygen is from lung disease or just from low oxygen in the air, like at high altitude. PaO2/FiO2 ratio, P/F ratio. This ratio is critical in ICU to diagnose ARDS and guide ventilation strategy. PaCO2 reflects ventilation, not oxygenation. A sudden rise in PaCO2 in a ventilated patient can signal a blocked airway tube, ventilator failure, or worsening lung disease. Always check PaCO2 along with pH to know if the change is acute or chronic. What is normal values in arterial blood gas? pH normal is 7.35 to 7.45. Lower means acidic, higher means alkaline. PaCO2 is controlled by the lungs. High CO2 equals respiratory acidosis. Low CO2 equals respiratory alkalosis. PaO2 tells us how much oxygen is in the arterial blood. Below 75 means hypoxemia. HCO3 is controlled by the kidneys. Low bicarbonate equals metabolic acidosis. High equals metabolic alkalosis. O2 saturation is percentage of hemoglobin carrying oxygen. Below 94% can be concerning in ICU. Base excess shows the amount of extra acid or base in blood. Outside -2 to +2 means metabolic imbalance. Before we interpret ABGS, there are three key values we must memorize. First is pH, with a normal range of 7.35 to 7.45. Below 7.35 means acidosis, and above 7.45 means alkalosis. Second is PaCO2, which represents the respiratory system. The normal range is 35 to 45, but notice it works in reverse. Higher means more acidic, lower means more alkaline. And third is HCO3, which represents metabolism. Normal is 22 to 26. Below 22 is acidic. Above 26 is alkaline. If you keep these three numbers in mind, interpreting ABGS will be much easier. This chart is what we call the Tic-Tac-Toe Method. We take the three main ABG values, pH, PaCO2, and HCO3, and place them in the grid. If the value is acidic, we put under acidosis. If it's alkaline, we place it under alkalosis. And if it's normal, it goes in the normal column. Once you place all three values, you can quickly see whether the problem is respiratory or metabolic. It's really like playing tic-tac-toe. Just line up the values and the answer becomes clear. This table shows us how the body reacts when there is an acid-base disorder, metabolic acidosis. pH goes down, HCO3 decreases. The body compensates by lowering PaCO2, breathing faster to blow off CO2, metabolic alkalosis. pH goes up, HCO3 increases. Compensation is raising PaCO2, slower breathing to keep CO2, respiratory acidosis. pH goes down, PaCO2 goes up. The kidneys compensate by retaining HCO3, respiratory alkalosis. pH goes up, PaCO₂ goes down. The kidneys compensate by excreting more HCO3. So basically, the lungs and kidneys work as a team. If one system is out of balance, the other steps in to help. In ABG interpretation, we can use the Tic-Tac-Toe Method to organize our thinking. We look at three key values. First, pH tells us if the blood is acidic, normal, or alkaline. Second, PaCO₂ shows us if the problem is respiratory. Third, HCO3 shows us if the problem is metabolic. The steps are simple. Step 1, check the pH to see if it's acidosis or alkalosis. Step 2, check which system, PaCO₂ or HCO3, is causing the problem. Step 3, see if the other system is trying to compensate and bring balance back. By following these steps, we can quickly determine whether the patient has a metabolic or respiratory acid-based disorder. Step 3 is to look at the pH value. This is our starting point. It tells us if the blood is acidic or alkaline. The rules are simple. If pH is less than 7.35, it's acidosis. If pH is between 7.35 and 7.45, it's normal, but watch the trend. 7.35 to 7.39 still normal, but leaning toward acidosis. 7.41 to 7.45 normal, but leaning toward alkalosis. If pH is greater than 7.45, it's alkalosis. So the pH is always our first step. It tells us whether we're dealing with acidosis, alkalosis, or still within the normal range. This slide shows how we place pH values into the tic-tac-toe grid. If pH is below 7.35, it goes under acidosis. If pH is above 7.45, it goes under alkalosis. If it's between 7.35 and 7.45, it's normal, but we note the trend. 7.35 to 7.39 normal, but leaning toward acidosis. 7.41 to 7.45 normal, but leaning toward alkalosis. This way, by placing pH into the grid, we can quickly visualize whether the patient is more acidic, normal, or alkaline. Now we look at PaCO₂, which reflects the respiratory system. Remember, its direction is inverted compared to pH. If PaCO₂ is above 45, it means acidosis, too much CO2 retained. If PaCO₂ is below 35, it means alkalosis, too much CO2 blown off. If it's between 35 and 45, it's normal. So be careful. PaCO₂ works in the opposite way compared to pH. We check if the body is compensating. Fully compensated. The pH is within the normal range, 7.35 to 7.45, but both PaCO₂ and HCO3 are abnormal. This means the body has balanced things out. Partially compensated. The pH is still abnormal, and all three values are off. The body is trying to fix it, but hasn't succeeded yet. Uncompensated. The pH is abnormal, and either PaCO₂ or HCO3 is still normal. This shows the other system hasn't stepped in at all. So by looking at compensation, we can tell whether the body is already balanced, is still trying, or isn't compensating at all. We look at HCO3, which represents the metabolic system, mainly the kidneys. If HCO3 is below 22, it means metabolic acidosis. If HCO3 is between 22 and 26, it's normal. If HCO3 is above 26, it means metabolic alkalosis. So remember, pH shows the overall balance. PaCO₂ points to the respiratory system, and HCO3 points to the metabolic system. Once we place all three values into the tic-tac-toe grid, the acid-base disorder becomes clear. This slide is basically a review of what we just talked about. As you can see, if the pH is less than 7.35, we place it under acidosis. If it's greater than 7.45, we place it under alkalosis. And if it falls in between, we should note whether it leans more toward acid or toward alkaline. So this slide is mainly for practice, putting the concept back into the tic-tac-toe grid. In the last step, We reviewed step 1, which is checking the pH to see if the patient is in acidosis or alkalosis. Now, in step 2, we need to figure out which system is causing the problem. If the abnormal value is in PaCO₂, that means it's a respiratory problem. So we call it respiratory acidosis or respiratory alkalosis. If the abnormal value is in HCO₃, that means it's a metabolic problem. So it's metabolic acidosis or metabolic alkalosis. So the flow is simple. First, pH tells us a direction. Then PaCO₂ or HCO₃ tells us which system is responsible. Now, step 3 is to see if the body is compensating. If the pH is normal, but both PaCO₂ and HCO₃ are abnormal, that means it is fully compensated. If the pH is still abnormal and all 3 values are off, that's partially compensated. If the pH is abnormal, but either PaCO₂ or HCO₃ is still normal, that's uncompensated. So by putting these 3 steps together, we can fully interpret the acid-base disorder and see whether the body is trying to keep balance. Let's look at practice problem number 1. The ABG values are pH 7.26, PaCO₂ 32, and HCO₃ 18. First, check the pH. A value of 7.26 is less than 7.35, so this indicates acidosis. Next, look at PaCO₂. The value is 32, which is below 35, so this indicates alkalosis. Now look at HCO₃. The value is 18, which is lower than the normal 22, so this indicates acidosis. Putting this together, both the pH and HCO₃ fall into acidosis, so the primary disorder is metabolic acidosis. Finally, check for compensation. Since all 3 values are abnormal, the body is trying to compensate, but the pH is still outside the normal range. This means the condition is partially compensated metabolic acidosis. Thank you all for watching today. I hope this lesson has helped you understand ABG interpretation more clearly. If you found this video useful, don't forget to like, subscribe, and share it with your classmates or colleagues. See you in the next session.